cancer rates are rising in young people. And a new study says accelerated aging may be to blame. Joining me now is Dr. Frank Contacessa. Right, Doctor, what exactly is accelerated aging?
Well, good morning, Stuart. Great to be with you. So what we're finding is that young people these days are biologically aging faster than generations that came before. So we're talking about things like oxidative stress, things from the environment, and this is a multifactorial thing. This is the environment. So, we're surrounded by toxins these days, preservatives in foods, prepared foods, highly processed foods. This affects our gastrointestinal system, but it's also sedentary lifestyle. People are sitting behind desks in front of computers more. The younger generations, everybody works in front of a computer. So what we're finding is that we're seeing cancer rates rising in younger people. And they're encountering things like diabetes and hypertension and things that you would normally associate with older age groups. We're seeing that in younger people now.
So the solution to this is relax, exercise, and change your diet. Is that it?
You got it. You hit the nail on the head there.
Okay, we'll move on. I'm really interested in this one. More than 100 deaths have reportedly been linked. They have been linked, reportedly, to weight loss drugs like Ozempic. And that includes a 28-year-old man who died from an intestinal mass and a pregnant woman. What kind of complications could these drugs be causing?
So, Stuart, this is an important topic. I have discussions about this drug almost every day in my practice. These drugs, these GLP-1 drugs they're skyrocketing in the amount of prescriptions that are going up. So thankfully, the rates of these adverse effects are pretty low. But the more you prescribe them, the more people we're going to find. So I've had several of these severe adverse effects. I've had someone with irreversible gastroparesis and ileus, which is when basically the motility of the gastrointestinal system shuts down, because that's one of the ways that these drugs work. They can cause pancreatic tumors. They can cause pancreatitis. So the important thing here is for doctors to screen their patients carefully. I'm not saying I don't prescribe these drugs. I do. But the first conversation when I have with someone who requests this drug, I usually try to talk them out of it. I usually try to counsel them to do the things that you just mentioned. Eat better, exercise more, live a cleaner, healthier lifestyle, which almost always works. So you have to select your patients carefully.
But the trouble is that these drugs on a mass scale are relatively new, and I'm not sure that we've got long-term studies of the effects. Have we got those long-term studies?
Some versions of these drugs have been around for a good 10 or 12 years, but they really weren't used very widely. They were pretty expensive and used only in diabetics. They are actually pretty good diabetes drugs, but for using them strictly for weight loss, we have to be really careful. I know that the temptation is there to say, hey, just give me a shot, let me take a pill, and the weight's just going to fall off. But Stuart, as we all know, there's no free lunch. There's always a downside to these things, and you have to be really careful with the patients that you prescribe these to.
But the downside is limited to a very limited number of people so far. Is that accurate?
Yes. Thankfully, it's a relatively small percentage of people.
Got it. Dr. Frank Contacessa, thanks for joining us. We appreciate it always.